someone who may already be on treatment.
Okay.
So for example, like if you went for knee surgery and you needed to rehabilitate, then in the recovery process, doing physio helps you to get better.
Right.
In the same way, if you had surgery for your sleep apnea or you were already using a device for sleep apnea, then sometimes these strengthening exercises may be able to help you.
Oh, I see.
Example of some of them are, holding your lips pursed and trying to prevent the air from coming out. It strengthens, constrictors of your lip.
Can you show me how? What would you
So you purse your lips closed, and then you try and hold the air in. And you repeat these exercises many times to strengthen it.
Right. Welcome to today's episode of Wake Up Call, the hidden dangers of sleep apnea. I'm Dr. Chai Ling, and today we're diving into a condition that affects millions but often goes undiagnosed, sleep apnea. Joining us is Dr. Lau Hung Tuan, an international fellowship-trained ENT specialist with a special interest in snoring and obstructive sleep apnea. Dr. Lau has vast experience treating patients with tailored holistic approaches, and he's here to shed light on why sleep apnea is more than just snoring and how we can manage it effectively. Dr. Lau, welcome to the show. So anyway, it's really good to have you here because actually sleep apnea, surprisingly, is one of the most common questions that my patients ask about. Even though my patients are girls, a lot of their boyfriends have sleep apnea. So can you just briefly give me an idea, what do you think is the prevalence of sleep apnea and who are most at risk to get this kind of problems?
So thank you for having me today. Sleep apnea is actually very common in what you mentioned. Globally, we are looking at a percentage of somewhere between 6 to 17% of people having sleep apnea. In Singapore, we have actually done some studies. In 2016, we did a study where we surveyed 2,000 plus people, and we found that the numbers are actually even higher. 30% of people have moderate or severe sleep apnea. If you look at risk groups for sleep apnea, generally adults who are above 30, male, overweight or obese. They may have anatomy issues like large tonsils or small jaws, and sometimes certain habits like excessive alcohol drinking or smoking they can predispose you to sleep apnea.
That's interesting that it's increasing because I've also had more patients complaining about sleep apnea. In fact, I have some relatives with it. Is there like a group that maybe say Chinese are more prone to it, or?
We'll go back to the study, and when we looked at the 3 major ethnic groups, then the Chinese and the Malay population tend to have an increased risk of sleep apnea.
That's quite interesting. So you're saying that one of the risk factors is large tonsils, but these are things that obviously we cannot see from the outside. They have to go and see an ENT specialist to diagnose this. But from the outside, from a person's exterior, are there signs that this person's going to have sleep apnea?
So when we suspect someone has sleep apnea, we're looking at symptoms. Symptoms, I would divide them into nighttime symptoms and daytime symptoms. At night, these patients or sufferers may have symptoms like snoring, usually loud. They may have witnessed choking episodes where the partner notices that they suddenly stop breathing and then they are gasping for air. The patient themselves may notice that they are waking up gasping for air, but usually, most of the time, they're unaware of these occurrences. They may also have very restless sleep, so they're waking up for no reason at all, which could be the choking episodes. They may be going to the washroom to urinate many times during the night. That can be sometimes explained by sleep apnea. In the daytime, they are unrefreshed quite often. They are sometimes excessively sleepy. They may be dozing off at work or behind the wheel or in public transport or at meetings. They may also have morning headaches and very poor concentration and just constant brain fog.
That sounds actually quite serious. I was about to actually say, what happens if you don't have a partner sleeping beside you so you don't know you are choking? But I guess you will know this by probably not functioning at your full capacity in the day, right?
Sometimes it's hard to tell because it's very insidious. It's something that's in the background, happens every day. You may in some ways be used to having a bit of tiredness and fatigue, and you brush it off as maybe I didn't sleep that well the night before, or work has been very stressful. or I've been traveling a lot. I think having someone notice how you sleep is quite useful. Sometimes patients who are single, who sleep alone, may not be able to have the privilege of someone noticing them.
Yes.
Or kicking them awake when they're snoring. I think sometimes what happens is if they travel, then travel partners, because quite often if you travel, you may share a room, will then pick that up.
Okay.
Yeah. Also nowadays, they have smartwatches. So people have Garmin's, they have Apple Watches, and they do pick up, with the apps, certain disturbances in your sleep. So they tell you you've got poor deep sleep, you've got poor sleep quality, or blood oxygen levels may be low. So that may raise your index of suspicion to then go and seek help.
That's actually very smart, using one of these smart watches, right? Because we are supposed to have certain number of hours of deep sleep. So if let's say I notice that I'm not getting that hours of deep sleep, that could be the first indicator that maybe my sleep is disrupted for some reason, right?
Yes, so they are not diagnostic. You can't diagnose sleep apnea very often with these watches, but they give you a good index of suspicion that maybe you should go and get it properly checked.
Okay.
It's a guesstimate.
Yeah. So, would you say that you were saying that men are more common than women? Do you actually see this in women at all?
We do. It is not uncommon in women.
Oh, okay.
So the men get it more, but equally then, as with snoring, over time as we age, our muscles in our throat, our airways sag, people do put on weight. So we do also have women who have sleep apnea.
So it's more common as you get older because of the change in muscles in our throat area. They become, say, less firm, as you say, sag, and that causes it?
Yes, so sleep apnea, there are a few different kinds, but essentially what happens is during sleep, then a apnea event happens. So the apnea can be something which is a complete obstruction, stoppage of breathing in your airway, or a partial stoppage.
Okay.
When that happens multiple times every hour, then you have sleep apnea.
Okay.
When we talk about patients with sleep apnea, then there are a few different sorts. Right? Some people have a obstructive sleep apnea, or OSA for short, which is the more common kind, where the airway, which is a collapsible tube, actually collapses because when you're awake, your airway, your muscles in your throat are supposed to keep them open.
Yeah.
Whereas you enter different stages of sleep, then your muscles relax and then the airway collapses.
Okay.
There's also something called central sleep apnea, where the airway doesn't collapse because it is lax, but your brain doesn't trigger off a breathing effort. So you stop breathing because your brain isn't signaling the body to breathe.
I see.
And then you've got a mixed sleep apnea where you get a mixture of both. But when we talk about sleep apnea, usually people refer to OSA.
Because that's the most common one.
That is the most common.
Right.
Yes.
Okay. So, in this obstructive sleep apnea, you were saying that it can also be quite structural, right? Certain things obstructing, like enlarged tonsils. So in that case, even children can have it because it's something they're born with?
Yes. So children do get obstructive sleep apnea. Very often, then one of the main contributing factors is having large tonsils or another kind of tonsil-like tissue in the back of your nose called the adenoid.
Okay.
It is a bit different from adults. Adults get sleep apnea. Usually they don't have big tonsils or adenoids, but because either with weight or jaw structure or the muscles being lax, the airway collapses.
I see.
So very often in children, one of the root causes is large tonsils and adenoids, and by removing them, we do improve quite a fair few patients, but not all of them are just purely due to large tonsils and adenoids.
I see. So, you were saying that all these smartwatches, they're not diagnostic. So how do we diagnose sleep apnea?
So the litmus test or the gold standard test that we do is a sleep study where we put you on some monitoring. We measure your brain activity, your breathing effort, your blood oxygen levels, your heart rate, and your chest efforts to diagnose whether or not you do have an airflow disturbance and a breathing event during sleep. So it's a sleep study that we do overnight. This can be done in hospital or it can be done at home. So more and more we're seeing that people shift from doing it in hospital to doing it at home because it's more convenient, it's less costly, it's easier to set up, it's not so resource heavy.
Okay.
There are also newer technologies with home testing where instead of many wires, we can Bluetooth some of these connections.
Oh, that's great.
Or we can use something very similar to a smartwatch that connects without as much cabling.
And then send the data off. Yeah, that sounds much better. So how long do you have to sleep for in this sleep study?
We usually say that we want you to sleep 80% of the night. and get a recording of around at least 4 hours.
I see, okay. So in hospitals, people probably will have to stay overnight. If they can bring these devices home, then they just, wear it to sleep?
Yes, so they bring a device home, they set it up at night, they sleep, it's recorded and uploaded to a cloud or database.
I see.
And then we analyze the results back end.
Okay. So let's say somebody has sleep apnea. The question really is, do we have to treat it? If, say, they have had it all their lives, do you think it's likely to get worse?
It can get better, it can get worse. Sometimes
okay.
that depends on one's weight. But barring any dramatic weight loss in someone who may be overweight, then often sleep apnea usually gets worse over time.
Because of the aging and the laxity of the muscles.
That's right.
Okay.
With that also comes the health risks that are associated with sleep apnea.
Yeah.
So when we look at sleep apnea, it's a spectrum of disease.
Yeah.
On one hand, you can have people who only snore, where it is just vibration of the tissues in your throat that creates the snoring sound. And that is in itself not a disease that needs treatment.
Okay.
Quite a lot of people snore.
So snoring is not sleep apnea?
It isn't sleep apnea, but it forms a broad group of people who may have sleep apnea.
It could be a symptom.
Yes.
Yeah. Okay.
Sleep apnea is then a subset within the snorers, where you can then have different degrees of sleep apnea. So you can snore, but if the snoring becomes worse than just turbulence and vibration, and you get choking episodes, then you have sleep apnea. And within sleep apnea, then it can be classified into mild, moderate, or severe.
I see.
What research shows us is that if your sleep apnea was moderate and above, so beyond a certain count, then we know that it is associated with different health risks. For example, high blood pressure, heart attack, stroke, diabetes, heart failure, palpitations.
What is considered mild and what's moderate and what's severe?
We use something called the apnea-hypopnea index, which is the number of times we count that you have a breathing disturbance with disturbances in your oxygen levels per hour. So less than 5 is normal. You don't have sleep apnea. If it was between 5 to 15, then you've got mild sleep apnea. 15 to 30 is moderate, and above 30 is severe. So 15 is the cutoff if we're using moderate as a cutoff for you to then have health risks if you leave it untreated.
So it's not just something that's a minor inconvenience. You actually have to treat this, because if your girlfriend doesn't kill you, the high blood pressure and the heart problems will in the future if you leave this untreated and it becomes severe.
Yes, so there's reason to treat, which is the untreated risk. But very often you will find that when patients see me or any ENT doctor, they come to you with symptoms. Right? They're not coming to you with a number. So when they come to you with symptoms, it's always, I'm snoring too loudly, or very often it's not them. They sit there very quietly and then the girlfriend or wife will be saying, he's been snoring very loudly, I'm sleeping in a separate room. Or they're very worried because they see their partner choking and stopping breathing every night. So they're worried that he's going to die in his sleep. So these symptoms drive people, or they're very unrefreshed, they're very unproductive at work. These are the motivators that one wants to seek treatment. Then you've got another group who already have heart problems or problems with controlling their blood pressure. They are aware, or through their cardiologists are aware of that the risk factor for all this is sleep apnea, and they may have the other symptoms. So they come trying to treat sleep apnea to help with their heart health.
Problems, So
for these reasons, these people are motivated to treat. But if you happen to have had a sleep study done and you don't really have many symptoms, maybe a bit of mild snoring, you're not tired, and I tell you about all the health risks, then I find that generally the motivation is not so there in terms of treating it.
So will you say if somebody is snoring, if I have a partner who is snoring, does it mean the louder the snoring is, the more likely he will have severe sleep apnea if I didn't notice him choking or whatever?
In a way, yes. The louder snoring usually represents turbulence, more turbulence and vibration in the airway. But also in a way, no, because sometimes when you suddenly go quiet and you can't breathe, that's when you're having a full apnea, a complete choking episode. So it can actually be quiet. And the loudness in terms of decibels is not directly related to how severe the sleep apnea is.
I see.
But the loudness is related to how frustrated the bed partner is.
Yeah, that's true. I mean, now that you tell me that our muscles can become a bit lax with age, I'm worried that I will start snoring, have sleep apnea as I get older. Is there anything that we can do to prevent these muscles from becoming lax as we grow older?
I think certain lifestyle habits can help. Okay. So maintaining an acceptable weight. Okay. With that, we mean a body mass index of below 25, or in some standards, Asian standards, below 23.
Okay. So weight loss is actually the first thing you tell your patients?
Those who are overweight.
The ones that are overweight, yes. At least, yeah.
So fat accumulates in your tongue, in your throat, in your neck.
Yeah.
And although you can't control where fat deposits and is lost, you know, that generally helps to maintain or reduce as much as you can the chances of sleep apnea. Secondly, then habits like smoking and alcohol also contribute to sleep apnea. So doing so in moderation or not at all is generally going to help, especially with things like snoring and sleep apnea. Lastly, then, probably more so for the people who already have sleep apnea, some people will actually do myofunctional therapy, which are exercises to do with the throat and the mouth and the tongue.
Oh, really? Okay.
To try and strengthen these muscles.
Are these difficult to do?
These are not difficult to do. Okay. They may look a little bit strange initially.
Can you show us how to do this? And is it beneficial if we do this at home so that we don't get sleep apnea in the future?
I think that they are a good adjunct. They are a good assistance to someone who may already be on treatment. Okay. So for example, like if you went for knee surgery and you needed to rehabilitate, then in the recovery process, doing physio helps you to get better.
Right.
In the same way, if you had surgery for your sleep apnea or you were already using a device for sleep apnea, then sometimes these strengthening exercises may be able to help you.
Oh, I see. Okay.
Example of some of them are, holding your lips pursed and trying to prevent the air from coming out. It strengthens, constrictors of your lip.
Can you show me what do you mean?
So you purse your lips close, and then you try and hold the air in.
Oh, okay.
And you repeat these exercises many times to strengthen it.
Right.
Some exercises are then moving your tongue to the roof of your mouth.
Oh, those are quite simple,
Quite simple to do.
Yeah. It's doable.
Doable.
Yeah.
But really trying to strengthen all the muscles in there.
So it's a bit like women doing Kegels. For you, this is like something you do every day, whereas we do Kegels wherever we are, right? Okay.
The difficulty may be that how much control your body actually has over these muscles when you sleep are sometimes difficult to judge.
Okay. That's true. So when it comes to treatment, say somebody has sleep apnea, what kind of treatment options are there out there? I think that's the most important question all my patients want to know. Can they be cured?
So there are quite a few treatment options available. We can divide them into non-invasive treatments and invasive treatments.
Okay.
The first line gold standard treatment for sleep apnea is something called CPAP, or continuous positive airway pressure therapy.
Yeah.
That involves one using a mask, which is either over the nose or nose and mouth, connected via a hose to a box.
Yes, I think my uncle actually has one of those.
Yeah, that box doesn't blow oxygen. A lot of people ask if it's oxygen going in. It's not. It's air, and by connecting it to your face, it opens up that upper airway, which is a collapsible tube, and keeps it open. So when you stand your airway open, then you won't get the snoring, you won't get the collapse.
But you won't get any girlfriends either. Do you have to wear this for life? I mean, my uncle's really old, but I can imagine all the young men. I mean, you bring a girlfriend home and then you're wearing this. It's quite scary, right?
It's not very sexy. People do complain you look like Darth Vader.
Yeah.
But it's wonderfully effective. It is 99% effective.
But it's only effective when you use it.
When you use it.
So you have to use it forever.
So you have to use it every night, throughout the night ideally. We set a target for our patients, 70% of all nights, more than 4 hours per night. For you to, when we look at research and for you to get some perceived benefit, that's how.
And can you stop it one day? I mean, does it have a cumulative or long?
It doesn't change your anatomy or the tone of your muscles. So I tell patients, It's a bit like wearing glasses if you're short-sighted, right? You wear them, you can see. You take them off, you can't see.
Oh dear.
Right? Same thing.
So it's like forever.
But people who are very tired or who like it swear by it. So they are very happy to use it. But that is probably
so they have 50%. A good night's sleep, right?
Yes, 50% to 70% of patients.
I understand. Okay.
For the others or whose sleep apnea are milder or who are just snorers, then another non-invasive method is to use something called an oral appliance.
Okay.
So that's a mouth guard that's custom built to your teeth and your jaw.
So they have to come to you to buy this mouth guard?
I prescribe it, but I get a dentist who is trained in doing that to then 3D mold and fit this guard.
Okay.
This guard, what it does is it slides your lower jaw forward. So you wear it a bit like those guards that people wear for teeth grinding.
Yeah.
But now it is pulling your lower jaw forward.
Okay.
So by advancing your lower jaw forward, your tongue comes forward, opens up the space, stabilizes some of that airway that vibrates.
So you wear this when you sleep?
You wear it when you sleep.
Unfortunately, again, not very sexy. You'll be single for life.
Less unsexy than
but still, you'll be...
Yes, so those are the two non-invasive options.
Yeah.
Some people, a small group of patients, have what we call positional sleep apnea, where from their sleep study we can tell that on their side, their sleep apnea is not present or very mild, only on their back.
On the back, okay.
So then potentially there is an option of sleeping on your side. But keeping you on your side, if it's not your natural position, can be difficult.
Okay.
So over the years, people have tried. They take a tennis ball, you sew it on a sock, you put it on your back, but people can still turn. There are pillows which are like wedges that you sleep and makes it look like it's a sharp stick.
So at least encourage the person to sleep on the side and then regularly turn on the side. So that's quite an easy fix. I think that's doable.
But it's hard to achieve that position throughout the night because you'll get neck ache, you get lying on your hand, let's say go all numb and tingly.
Okay.
So
extra pillows, does that help?
Propping up, not so much. Right? Although I think if you go online, you will find many.
Yes, there's so many. How about those beds that sort of incline? Do they help?
They do help a little bit,
Only
but I don't think it will be a cure-all for sleep apnea.
Right.
Invasive options, then we are primarily talking about surgery.
Okay.
There are different kinds.
But people are quite motivated. I mean, my patients at least don't mind if there is a definitive solution to it.
Yes, so often they want one-off solutions for their sleep apnea. And that may be broadly 3 types of surgery. One is what we call upper airway soft tissue surgery. So we correct any blockages in the nose, whether you have a deviated septum or large turbinates.
Do most people with sleep apnea have some sort of structural issues?
Some of them do in the nose, but some not. But what we're trying to do is to as much as possible, encourage them to be able to breathe better through their nose so that you don't mouth breathe. Because when you mouth breathe, then your airway is more resistant. It's less efficient.
So basically, when we are sleeping at night, we should be breathing through our nose, not our mouth.
Yes. Yeah.
Okay.
So from birth, we do that, and ideally, we want that to continue.
I see.
Which is one of the reasons why if someone has sleep apnea or who was snoring and mouth breathing as a child, we strongly encourage you to bring them to see a doctor.
To try to correct this, right?
You don't want it to become a lifelong habit.
How about taping their mouth when they sleep?
Some people do try that. It is sometimes difficult because when you tape your mouth, then naturally people still are able to drool. With the saliva, the tape falls off.
I see.
Yeah.
Okay.
Back to surgery, then there are other kinds. So besides doing the nose, then some people remove their tonsils, trim certain tissue at the back of their tongue and throat, and tighten it. So essentially, you're trying to open up the airway by using scar and tension, so that you don't have that choking episode.
Is this a major surgery?
This is considered probably medium surgery. Yeah.
And how successful is it? Is it like a one-off, or do you have to go back several
times? It is a one-off, but I tell patients that the success rate in a well-selected patient, so someone who's ideal for this kind of surgery, is about 2/3. So there will be still 1/3 who it doesn't work.
Yeah.
Even if it works, even if your snoring is better, even if your sleep test results are good, then because it is scar essentially that holds that tension, over time that can lax.
So have you had patients where after the surgery, it actually worked for a few years, then they fall back to the problem again?
Yes, they are.
Yeah.
So then you go back to looking at all the options available.
So can you repeat the surgery? Because obviously it shows that the scar tissue, the tension is wearing out.
The surgery for the throat is not easily repeated.
Okay.
We don't find that it's very effective as well.
Okay.
So there's only so much in
Yeah.
the throat that you can remove or
Yeah.
tighten beyond the maximum point.
So it's not like breast implants. After doing it, if you don't like the size, you can go back and change to a new
No,
one. But for
yeah.
the throat, because you're removing stuff, after a while, you can't actually do that.
Yeah, so
Okay.
I think for people looking for that definitive one-off treatment, yes, but
Okay.
with the full knowledge that it can come back or it may not be successful.
Well, so actually, I've learned a lot. It's actually a bit more complex than we think it is. There's no one definitive treatment, and you actually have to try to use all sorts of measures to help
Yes.
you get better and to manage the whole condition.
Yes, so people may not like CPAP, for example, to begin with, and may eventually decide to go back to CPAP because
Yes.
they've tried other options and it didn't work.
Yeah.
There's also jaw surgery. So if someone had small lower and upper jaw,
Okay.
we can actually move the jaws forward.
That's quite major, I think.
That's quite major.
Yeah.
They look different.
Yeah.
They bite different.
And that's clearly for the people that you can tell with the receding jawline, right? So they may
Yes.
do that also for aesthetic purposes, you think?
So it is always a balance between airway, which is the breathing, the aesthetics of how you look,
Yeah.
and also your occlusion, your bite.
Yeah.
Right? Quite often then, if you were having a very receded, very small
Yeah.
chin, doing these procedures, most of the time, even though some may not be very used to it, it does lead to medically what is more of a aesthetically pleasing face.
That's actually interesting. I had one patient who told me that he did Invisalign and he has always had a bit of snoring and sleep apnea, but he thought that it improved after Invisalign. Is that possible?
Potentially, if let's say that the aligners are able to get him to bite a little bit more forward,
Okay.
or in a way that opens up
Yeah.
his airway.
Okay.
We also have patients who do not have a receded chin or a small jaw,
Yeah.
but because they've run out of the soft tissue throat surgery options,
Yeah.
they do the full advancement. So then they look very strong, very
Okay.
protruded.
Yeah, but that is a huge surgery. What kind of downtime are we looking at, and what kind of risks and complications?
You are looking at a 1 to 1.5 year
God.
preparation with braces
Okay.
for you to then be able to move the jaws.
Yeah.
You are then looking at a surgery which usually isn't very painful, but you wake up looking quite swollen.
Yeah.
A bit
And you
like-
have no solid foods for a while after that.
and you can't take solid foods for I think a good 6 to 8 weeks.
But maybe their sleep apnea is better because they lost so much weight, not being able to eat solid
I
food.
think in the old days, then after this surgery, people used to wire the teeth.
Oh my God.
So then everything was
Again, destined to be single. So all your treatment for sleep apnea, your patient is destined to be single.
so far not very promising.
Yeah, it's not very
except for the
promising.
throat surgery, which is results-wise not fantastic for some people.
Right.
There are two other kinds of surgery. One is weight loss. So if you're obviously obese,
Okay.
it may not be surgery.
Yeah.
There are newer drugs out there that can help you with weight loss. But if you were obese or on the high overweight side, then shifting the amount of weight, we find that does improve your sleep apnea and the symptoms that come
Okay.
quite significantly.
So just general weight loss and everything.
Yes.
Okay.
And then finally, this is something I'm excited about. It's relatively new in Singapore, where we implant almost like a pacemaker for your tongue into your body. So we implant a chip
Under the skin or just where?
under the skin in your chest.
Yeah.
It is connected under your skin of your neck to the nerve that moves your tongue, called the hypoglossal nerve.
Okay.
And at night, when you turn it on remotely,
Yeah.
it sends gentle pulses to your tongue, and it moves your tongue forward with every breath.
But this will be only for people who has a functional issue, or it doesn't have to be anybody's tongue?
Anybody's
optimal.
tongue, because it's connected to the nerve. So if your
okay.
sleep apnea was moderate and above, and
Yeah.
you were a suitable candidate, and you didn't want to, or you tried and couldn't use CPAP,
Yeah.
you are not going to use the oral appliance. You may have tried other surgeries, or someone has told you that these surgeries are not ideal for you. then this may be an alternative where you don't have a mask,
Yeah.
you don't have a hose,
Yeah.
you have the machine, the
It sounds
generator
exciting. Yeah.
in your neck and in your throat, and then you turn it on, and it's been shown to be about 80+% effective.
Okay. So again, this is for long term. It is like you're going to wear it like a pacemaker.
Yes.
It's going to be, but I presume it must be a very small chip. It cannot be like a big remote control kind of thing, right?
About this size.
And you will put it underneath the skin. Is the surgery to do it difficult?
Surgery is
Connecting it
a
all?
day surgery. It's not very difficult. It's not very painful. But we also have to bear in mind that after all, it's an implant.
Yeah.
So with implants, then come issues with, foreign material.
Yeah.
But also battery change.
How often do you have to change the battery?
Every 11 years.
Oh, so it's okay because the battery will be here, right? Just
Yes.
underneath.
So we don't have to touch the wires above. But that battery on the top of the chest below your collarbone has to be changed every 11 years.
So you just have to sort of like turn it on and it will move your tongue forward.
Yes. Time to your breath. So only during sleep.
Oh, that's actually quite amazing. How long has this technology been out and has it been tested and studied?
It's been FDA, so US FDA approved for 10 years.
Oh, so long.
Yes, so in the US, then insurance is fully aware of it and will cover these sort of treatments for sleep apnea. In Singapore, it's been around for 2 years.
Okay.
Globally, then in the last 10 years, we have implanted 60,000 plus people.
Oh, okay.
In Singapore, we've just passed 100 last month.
Okay, I see. So it's relatively new. But people will find improvement in sleep apnea as well as their snoring, right? So a lot of parameters must improve.
So the way that we measure success is through looking at the apnea-hypopnea index, so the choking count.
Oh, okay.
So that has been shown to be 80+% effective.
I see.
But I think other things like snoring, satisfaction with machine use, then the feedback so far has been very, very positive.
The reason why I keep talking about snoring is because the two girls behind the camera, they are very excited about any new technology because they say that their boyfriends are snoring very loudly. So I'm thinking more in the context of for the partners, what kind of relief can they get? Will this help them have a good night's sleep?
All treatments, not only the implant that we talk about, if they work well, then you would see positive effect. Positive effect in terms of the sleep apnea score, but also in terms of symptoms. So be it the snoring, the choking, the tiredness, we want all of that to improve. Oxygen level drops also to improve.
Okay.
It's funny because patients, girlfriends and wives bring them to see me, and then they complain about the snoring, and after they have used CPAP, for example, treatment, they come back and then I ask them, so are you sleeping better now? The answer is no. I say, well, I'm so used to the snoring. Now that he doesn't snore anymore, I don't know if he's alive or not.
Okay, yeah, but actually there are also a lot of devices. Actually, I have one, what was it? Yeah, I had actually one of the instruction leaflets for one of the products some people have used. It is these Breathe Right strips. Have you ever seen? And do they help with sleep apnea? I think you paste it on your nose.
So not directly with sleep apnea,
Oh, okay.
but they may help you with your nose breathing.
I see.
So what a Breathe Right strip does is that it's like a plaster over your nose. It's trying to hold the cartilage that tags your nose and gives it shape out.
Yes.
So you're trying to prevent something called a dynamic nasal valve collapse.
Yes.
So when you prevent that, then patients do not have problems of having blocked nose when they breathe in.
Yeah.
So some people, the cartilages of the nose are weaker.
So it may help for some people.
It may help. So quite often you see that in a Caucasian population where they've got larger noses with weaker cartilage that can collapse quite a fair bit. We do see that also in our local population.
Okay.
And if you can improve the nose breathing, ideally then people have more efficient breathing,
So,
like when you don't mouth breathe. So then potentially the snoring gets less.
Gets better.
May not improve
Sleep
sleep apnea.
I see. Is there any medication that can be used to treat sleep apnea? No, right?
At this moment in time, I think the medications are still in the research phase.
Okay.
So that's one exciting aspect of sleep apnea treatment, which is not at the moment for public use, where we are trying to look at sleep apnea in a very root cause analysis way, and by looking at the different mechanisms that cause sleep apnea, trying to use certain drugs, certain medications to address some of them. But nothing so far is in the market that you can give that will suddenly make the airway expand and your breathing stable.
Okay. So if somebody has sleep apnea, they just want to know, is there anything they can do in their daily lives that can maybe minimize their chances of, getting it later or improving their symptoms now? Things like exercise, does it work? Supplements? Any kind of those nasal decongestion sticks that they can stick up their noses?
I think if you had a blocked nose, to have it treated would be useful.
Okay.
So if a lot of people have nasal allergies, I think a good 25-30% of people have it in Singapore. And having a blocked nose is not ideal for your sleep because, if you ever had a cold or flu, then someone may tell you that you're snoring worse.
Yes.
And so treating it, keeping it under control, whether if you're having it chronically daily, it's ideal. Some people do rinses like you mentioned.
Yeah.
Decongestants that you can get over the counter, we don't encourage to use them regularly, meaning more than 5 to 7 days.
Okay.
But if you've got bad allergies of your nose, then please get treatment and have it treated so that you can breathe better.
Okay.
Exercise is, of course, something to encourage.
Yeah.
I think that helps you to sleep better. Of course, not exercising too close to bedtime.
Yeah.
But keeping that kind of a healthy lifestyle does help you to keep your weight at a certain level or help you to lose weight if you're overweight.
So you mentioned alcohol. How about things like caffeine? Does that affect people?
Not directly sleep apnea, but I think if you are already having trouble sleeping, which sometimes patients who see me don't just have sleep apnea, they come in because they can't sleep.
Yeah.
Then having a routine that encourages good sleep hygiene, it's also important. So that's not too much caffeine, especially later on in the afternoon or evening. Not having too much blue screen time.
Okay.
Using
so all
your
these
bed.
are good sleep habits. Okay. So I have patients that have told me all these strange myths about sleep apneas, and maybe I can tell you what some of them, the beliefs are. Now, of course, some believe that sleep apnea is something that will only happen in older men, but I think you've dispelled that, right? Because children can have it, women can have it.
Yes.
But how would a woman and a child know? Because usually they're not that tired. How will you diagnose them?
I think for children, seeing how they sleep, whether they are mouth breathing or snoring, is
mouth
important. Sometimes their mouth breathing habit is also apparent in the daytime.
Yeah.
And children, it's really important to try and catch them early.
Yes.
Because their faces are growing. And with that, then the effects of mouth breathing in narrowing your face and making your jaw very sunken and pulled back, they're going to mold how your face grows.
Right. Okay.
And when you reach that golden age where you stop growing, everything is locked in.
Yes.
And then for the rest of your life, you're going to have to do it. And the only way you can change the anatomy is if you go and do jaw surgery.
I see.
So we stop growing when we are 16 to 18 in terms of our facial growth.
Yeah.
So catching them earlier is very important to prevent things that can happen in adulthood.
Okay.
Women, interestingly, then they equally can snore, and like adults, they are usually more tired when they have disturbances.
Yeah.
And husbands do complain, and they do bring them in sometimes.
So women also can have this and they can snore.
Yes. Children are not so tired. So generally, even if you have sleep apnea as a child, the opposite happens. They sometimes are hyperactive or they have poor concentration, or they may be going to the toilet many times or still bedwetting at night. That may be
So these are the
telltale signs that you want to
Actually,
investigate.
that's interesting. I actually had one patient tell me that he realized he had some issues because he was driving home after work and then he fell asleep at the wheel and his car almost hit a barrier because he was so tired. So he fell asleep at the wheel and he wasn't drinking. So that could be one of the serious symptoms of perpetual sleep apnea cropping up, right?
Yeah, so safety, I think, is a major issue. And from time to time, there are people who are excessively sleepy and who are dozing off.
Yeah.
And that can pose a massive danger to yourself and also those around you.
Yeah, okay. I have another patient telling me things like, because their sleep is not so good, they take sedatives at night. But that, to me, probably wouldn't make sense, right, if you have sleep apnea. Because it may be even dangerous if you are so sedated and you can't breathe.
So most sedatives, be it alcohol or sleeping pills, do affect the airway. They make it more lax, so that can make the sleep apnea worse.
Okay.
But I think we also recognize that if you have insomnia and sleep issues, then you may sometimes need this kind of medication as treatment of your condition.
Yeah.
So sometimes the two have to run in tandem.
Yeah,
You know,
okay.
you have to treat the sleep apnea with, whatever device or treatment options there are.
Yeah.
But you also at the same time have to treat the insomnia. It's not always about pills. There are also behavioral therapies that some of the psychologists and psychiatrists use to try and address that.
Okay. So how about things like melatonin? Will that actually make the airways more lax, or is that a safer alternative or not really?
It doesn't make the airway more lax, but melatonin is something our body naturally secretes to try and regulate our sleep cycle. It's generally recommended if anyone were to use it more in the short term. It won't make your sleep apnea worse, but some people do find that using melatonin does help them to sleep. I think very often if someone travels quite a lot and goes through different time zones, then using melatonin is one way to try and regulate back your sleep cycle.
I see. And of course, the other myth, I think, is that surgery is a cure-all. But like you say, it only cures a percentage of the people, and you can actually have success rate, and then it falls off again, right?
Yes. So surgery is not perfect. I think it is definitely one-off. We hope that it's one-off. But it is nowhere near 100%.
Okay.
So we have to think about it and go in with our eyes open. Not everyone will want to wear a device or use an implant long term. But we have to accept the risks and also the success rates that come with any surgery.
So right now, what do you say is the most common treatment for sleep apnea? Is that the CPAP? Because that's probably has the longest history of people using it.
Yeah, so the CPAP is widely available. It's the most commonly used treatment. It is cheaper than doing surgery, and it is also more effective. So as the majority of patients would still be using that first. And medically, then we always would try and get you to use CPAP as your first option.
Okay. So you were talking about the hypoglossal nerve stimulation. If you had that, you probably don't have to combine with the CPAP, or is that something people would do in combination?
You usually wouldn't have to combine it with CPAP.
Okay.
Some people, that smaller percentage where the stimulation does not work or work fully, sometimes they may combine it with either surgery to try and improve the airway if they've not had it before in the throat, or potentially maybe even like a mouth guard, because that gives you a bit of an added effect in terms of opening up the airway.
So, based on what you say, wouldn't it be, if a person is slightly obese and sleep apnea, those are probably easiest treated, right? Because you can suggest weight loss. But if somebody is skinny with sleep apnea, I think it would be more complicated to find out how to treat them. Is what am I saying correct?
They would, in a way, yes.
Because you have your obstructive and the central causes. So I presume if you are overweight, very easily, you can suggest weight loss and it may help.
Yeah. It's probably actually easier the other way around.
Oh, really?
Yeah. I think that if you were skinny, you had obstructive sleep apnea, so not the central or mixed sleep apneas, and we know we're dealing with OSA, then at least if you didn't use CPAP, you can't use an oral appliance, you would more likely, without knowing what your jaw structure is, be a better surgery candidate.
Oh, okay.
Versus if you were obese or overweight, where beyond a certain BMI, we know that the success rate drops off the cliff. And then I tell you, surgery is definitely not for you.
So, even people want to go for surgery, if they are obese, they are not a candidate for surgery. So whatever it is, they need to be in a correct weight to even consider surgery.
Yes, but again, with surgery, it is different kinds, right? So throat surgery, there's a limit that different doctors have different cutoff points, but that we try not to go beyond.
Okay.
With jaw surgery, then also again, we know that the results are poorer if you are obese.
Okay.
But I think that the limit is not as low as, for me, soft tissue surgery. And then for the implant,
Yeah.
studies show that you can go up to a BMI of 40. BMI of 40
And it
is quite
will
high.
still work.
And it still works.
Okay.
Of course, we want you below 32.
Yeah.
But 40 is quite a high BMI.
Yeah.
Not many people in Singapore are above 35.
Yes. You know, I think the main problem with CPAP is that a lot of people tell me when they're traveling or on the planes, how are they going to wear this? And I have one patient who tell me that he is scared of falling asleep on the plane because his snoring is so loud.
So I have patients who have an oral appliance for that reason.
Oh, okay.
Yeah.
So they mix and match. They wear the oral.
They wear it on the plane. Okay. They wear it when they're traveling because it's, you know, with carrying a machine and electrical points, sometimes it's easier, it's more portable to bring an appliance, and then they use CPAP at home.
I see.
Or they buy a travel CPAP. So you can't use it on a plane, but it's small enough that you can, it's very portable that you can bring it on your travels.
Okay. Yeah. Well, that's all very interesting. Is there any take-home message you can give our listeners about sleep apnea? Maybe something I haven't asked, or, you know, a myth you want to dispel. Is it more common than we think? Is it more treatable than we think?
So I think sleep apnea, if you suspect you have sleep apnea, if you are snoring and you have symptoms like you are tired and just not very productive, then it's quite important that you get yourself tested or you get your partners tested. Yeah. It is much more common than we think it is. Out of that 30% in our study that in Singapore that have sleep apnea, 91% are undiagnosed.
Wow, that's a huge number.
So we are diagnosing only about 2%.
So all the partners out there really need to stay awake tonight to listen to their partners sleeping and they're snoring very loudly. Possibly there is light at the end of the tunnel. They can bring them to see you and see if they actually have sleep apnea, right?
Yes, because I think the consequence of it is that, you know, it can be in the good case scenario, just a social nuisance.
Yes.
But if it is more serious than that, then you get loss of productivity, your work performance is affected, your relationships are broken because the snoring has driven your partner out of the bedroom. Sleep apnea also decreases one's libido, so that can be another
that's very
cause
important.
And then you've got all the health risks, right? So, you know, your cardiac risk, your risk of stroke, risk of diabetes and blood pressure. So those are things that we really should try and treat. Even if you don't want to stay up at night to watch your boyfriend or husband sleep, then download the app, right, and just leave it on. Then you have recorded evidence that, you know, this is happening. So that's useful.
See. Okay. So if somebody is snoring very loudly, it doesn't really mean they have sleep apnea. But if they're just snoring very loudly and they don't qualify as sleep apnea, it still can be treated, right?
It still can be treated, quite often with some of the means that we talk
options,
about. But usually if it's very loud, then we do suspect, you know, you've got a 1 in 3
borderline.
You would have something.
Okay. So, you know, it's clear you all don't have to move to a separate room. All you have to do is check if they have sleep apnea, and this can be treated. So thank you very much for joining me today. If there are any questions, I'm sure our listeners can find you. We'll leave the link down below, and they will just message you directly with their questions.
Thank you so much for having me again.
Thank you, Dr. Lau, for your valuable insights into sleep apnea and how we can better manage this condition. It's clear that sleep apnea is a serious issue with far-reaching impacts on our health. I hope our listeners have learned the importance of early detection and treatment. If you suspect you or someone you know may have sleep apnea, don't hesitate to consult a specialist. Thank you for tuning in, and until next time, take care of your health and sleep well.